Hi, everyone. My name is Kate Smulligan, and I am a PhD student at the University of Colorado. And on behalf of my co-authors, I'm excited to present our research on post-concussion dizziness and postural instability. A concussion is a traumatic brain injury that's induced by biomechanical forces that can result in cognitive and motor deficits. It's most frequently thought of as a blow to the head, which it often is. However, a concussion can also occur without contact to the head if there's a big enough force to the body, with that force transmitting up to the head. And that can cause the brain to move and shear inside the skull, which can cause a concussion. The symptoms of concussion are heterogeneous and generally fall into these four areas. For the purposes of our study, the focus was on the physical component, specifically looking at dizziness and balance and gait impairments. Because dizziness is largely a subjective symptom, we wanted to investigate how dizziness manifests clinically post-concussion. And our primary objective was to investigate the association between post-concussion dizziness and objective measures of static and dynamic postural stability. Our hypothesis was that individuals with dizziness post-concussion would demonstrate worse performance on these measures of postural stability. We had a total of 131 subjects included in the study. 73 were controls, and we had 58 subjects post-concussion, and they presented to Children's Hospital Colorado an average of 7 days post-concussion. We then separated our concussion participants into dizzy and not dizzy groups. And we did this using the post-concussion symptom inventory, which is a self-report measure of many of the common post-concussion symptoms. So of interest to us for this study was dizziness, and each participant rated their dizziness at 2 different time points, their current dizziness, as well as their pre-injury dizziness, which served as a proxy baseline. And then we took the difference between those two scores from the 2 different time points. So if the difference between the current and the pre-score was 3 or more, we placed them into the concussion dizzy group. And we chose 3 as that cutoff because that indicates that dizziness was at least a moderate problem for them. And if the difference between the current and pre-dizziness ratings was 2 or less, we placed them into the concussion not dizzy group. We assessed dynamic postural stability using the timed tandem gait test, which has been shown to detect impairments post-concussion. So patients for this test walk heel-toe along a 3-meter line on the floor, turn and return that same 3 meters walking heel-toe. And the outcome of interest is the time it takes to completion. They do this under single task condition, which is just the tandem gait test. And then they also do it under dual task conditions, which is the same tandem gait test with the addition of a dual task. And the tasks were things like spelling words backwards, reciting the months backwards, and counting backwards by 7s. We then used one-way ANOVA to evaluate the differences between groups. So looking at this graph here along the x-axis, we have our 3 different groups. Along the y-axis, we have single task tandem gait time with increased time indicating worse postural stability. And then for the violin plots, the white dot in the center here, that's the median time for each group. And then the blue rectangle around the white dot, that's the interquartile range. And then the light blue around it shows the distribution of time for each of the groups. So what we see here is this really interesting result. It's a stepwise pattern where the concussion dizzy group has the worst performance, followed by the concussion not dizzy group, followed by the control group who has the best performance. And the difference between each of the 3 groups is statistically significant. Looking at dual task, we see a very similar pattern where the concussion dizzy group has the worst performance, and the scores between each of the 3 groups is statistically significant, or the difference between the scores. So what we see here is that there is an association between post-concussion dizziness and impaired postural stability. We next used the balance error scoring system to measure static balance. And this is one of the most commonly used outcome measures in concussion. It is 3 different conditions of narrowed base of support. and each participant holds the position for 20 seconds with their eyes closed. And while they're holding their balance, we're counting the number of errors they make. So anything in this box is considered an error or a loss of balance. So the higher score on this indicates worse balance. So here again, we have our three groups along the x-axis. We have the best score with higher scores indicating worse balance. And we see a similar pattern where each of the concussion groups has a higher score than the control group, indicating worse balance. And the difference between each concussion group and the control group is statistically significant. What's different here that we didn't see with Tandem Gait is that the difference between the two concussion groups is not statistically significant. So what this is telling us is that the BESS is not detecting the differences between the dizzy group and the not dizzy group, the same way the Tandem Gait did. So the BESS is just not as sensitive at about a week post-concussion. So overall, our results indicate that there is an association between post-concussion dizziness and impaired postural stability. However, our study design was cross-sectional, so we can't draw any firm conclusions about the directionality of this relationship. So we would really need prospective studies to further understand this relationship. Clinically, our results indicate that in the context of post-concussion dizziness, Time Tandem Gait may provide some useful clinical information. So thank you very much. I am happy to answer any questions. And if you have any follow-up questions, please feel free to email me. And thank you very much for your attention.